Okay, let's start. Hello friends, I'm restarting my journey toward the anatomy with a small pause, and let's start discussing a few important topics from the examination point of view, and one of them is this dural venous sinuses. If we are familiar with the venous sinuses, these are the different sinuses which are present in between the different meningeal fold, especially in the meningeal layer of the dura and the endosteal layer of the dura. Few of them are unpaired, like the superior sagittal sinus, inferior sagittal sinus, and so on, and few are there are paired, as sphenoparietal sinus, cavernous sinus, so on. So I want to discuss here a sinus that is known as cavernous sinus, and I want to show you the place of this cavernous sinus, how minute this is in comparison of other sinus. By the side of this pit which is present in the sphenoidal bone, this is a pit that is known as hypophysis cerebri. This sinus is present somewhere here, it is, and only 2 centimeter by 1 centimeter, 2 centimeter in 1 by 1 centimeter. Its length is almost 2 centimeter in length and 1 centimeter in breadth. So why this is so important in comparison of other dural venous sinuses like the superior sagittal sinuses, which is almost 6 centimeter on one and a very long, lengthy. Why this sinus is important? Because this sinus is not only draining the part of the brain, but this is also draining structures outside the brain, and it is also highly communicable to other dural venous sinuses and outside the brain too. So that anything that is a septic foci which is situated outside the brain can lead to thrombosis of this one, and thrombosis of the one cavernous sinus may lead to thrombosis of many by which this is communicating. So this is anatomically very important, that is known as cavernous sinus. And not only that, in wall and in relation of this cavernous sinus, many important structure lying. So I am discussing about the this sinus that is known as cavernous sinus. And to understand this one, I'm going to draw two beautiful diagrams, and one is a coronal section passing through the cavernous sinus, another one is a transverse section passing through this cavernous sinus, or a schematic diagram showing the cavernous sinus. Okay, simultaneously we will draw this one. Question number second, why this is known cavernous sinus? Okay, why this is known as cavernous sinus? Like other sinuses that are developed between the endosteal layer of the dura and the meningeal layer of the dura, this sinus is also developing in between the endosteal layer of the dura. Okay, with the help of this purple chalk, I am drawing the endosteal layer which having a tendency to go with the bone, okay, endosteal layer of the dura. This is the endosteal layer of the dura which is lying here. Okay, this is the endosteal layer of the dura. This is the endosteal layer of the dura. I am drawing this. This is the endosteal layer of the dura. Writing this one. Endosteal layer of dura. Second layer, that is the meningeal layer, exactly starting from this zone. I am drawing another layer that is known as meningeal, starting from this area, but goes upward, and taking a gap, forming a roof, similarly on this side. The meningeal layer is also running with this one, but where there is a discrepancy in between the bones, that is going upward, forming a roof, reappearing to meet with the meningeal layer, for the stalk of the pituitary, This is showing the both side cavernous sinus. Okay. This is the meningeal layer. So a gap is created. A gap is created between this green layer, that is known as meningeal layer of the dura mater, and endosteal layer of the dura mater. This is meningeal layer of dura mater. But that is not enough to create a venous sinus. There should be subendothelium leaning, and for that I am drawing this diagram. There is endothelium leaning of this sinus. There is some kind of endothelium leaning of this sinus, and this is now completed. This layer is the endothelium layer. Endothelial layer. This is the endothelial layer. Again, I am drawing this one and purposefully forming the loop in the lateral wall, and that is showing the endothelium forming the sinus. Now this sinus is completed. Just not enough, we can draw the blood, a shadowing of the blood in the sinus, shadowing the blood in the sinus, and the fibrous septa, due to which this is known as cavernous sinus. Okay, a small shading of this one, here it is, which is showing it's a blood filled space, and few fibrous septa showing that this is the cavernous sinus. Okay, that is a section, that is a coronal section passing through the cavernous sinus, clearly showing that the endosteal layer goes with the discrepancy or the up and downs of the bone, so it's not going anywhere. But meningeal layer is changing its track, is going upward, forming a roof, and restart to join this one. Okay, so that the gap is created, and this gap is leaned by the endothelium, and this gap which is leaned by the endothelium is now known as cavernous sinus. This is the cavernous sinus. Similarly, I want to draw a transverse section here which is showing the cavernous sinus. Okay, here it is, just behind the superior orbital fissure, a venous sinus of 2 cm by 1 cm, which is more in the length, that is 2 cm in length by 1 cm in length. This sinus is known as cavernous sinus. This is known as cavernous sinus. Okay, this is the cavernous sinus. By two view, one is the transverse view passing through the cavernous sinus, another view is the coronal view showing the different relation of the cavernous sinuses. Okay, now this is the diagram showing the anatomy of the cavernous sinus. I am moving toward why these loops are present, by the side of the cavernous sinus. So we can see there is some external relation and some important anatomical related structure within the cavernous sinus. First of all, I am talking about within the cavernous sinus. Okay, within the cavernous sinus. Within cavernous sinus. Okay, within the cavernous sinus, first of all, in the lateral wall of the cavernous sinus, nerve number 3, which is supposed to be oculomotor nerve. Okay, oculomotor nerve, and that is known as third nerve. After piercing the roof of the cavernous sinus, it's appearing in the lateral wall, that is the third nerve, and you can see this is the meningeal layer and this is the endothelium lying between the endothelial layer of the sinus and the meningeal layer of the dura mater. This is third nerve. Next to this, the fourth nerve again entering from the oculomotor trigon, fourth nerve, that is the trochlear nerve, passing through the diagram, this lateral wall, trochlear one, is passing through oculomotor trigon again, appearing in the lateral wall, and again between the lateral wall of the cavernous sinus and the meningeal wall of the cavernous sinus and the endothelium. Just below this, the fifth one, I say it fifth one, that is the ophthalmic, fifth one, ophthalmic, again lying in the same place. Okay. Then the maxillary, this is the maxillary, and this is controversial. Few books say the maxillary even not lying in this lateral wall, this is outside, okay, but conventionally even the maxillary nerve is passing through this one, okay. So structure found in the lateral wall of the cavernous sinus are third nerve, fourth nerve, fifth one, fifth two, and fifth three. If you are searching fifth three, this is lying lateral to cavernous sinus. This is not within the wall of the cavernous sinus. Few book says even the maxillary one is not lying there. So this is also present there, lateral wall. Now coming toward the medial wall, and medial wall having an artery. This is an artery which is entering into the cavernous sinus, both sides. And this is very, very important artery which is going to supply the brain, that is known as internal carotid artery, which is surrounded by the sympathetic plexus. This is surrounded by the sympathetic plexus. This artery is known as internal carotid artery, and this is surrounded by the yellow color, or you can show by the dot, that is known as sympathetic plexus. That is not enough. Even inferior lateral to this one, there is a nerve, very, very important nerve. Inferior lateral to this, there is a nerve that is known as sixth nerve. And abducent, okay, abducent nerve. I am completing this diagram here. In between the meningeal layer and lateral wall, the third nerve, this is the third nerve. Then there is the fourth nerve, that is the trochlear nerve. Then there is the fifth one, ophthalmic nerve, fifth one. Then there is the fifth two, and it's controversial. Some books say that is outside. And lateral to this, there is the mandibular nerve, or fifth three, which is emerging from the trigeminal ganglion. That was about the relation of important anatomical structure within the cavernous sinus. Now important thing is, what are the structure outside the cavernous sinus related to this one, because that is also important. And first and foremost, I am drawing this structure, that is stalk of the pituitary. Can you see, this is the stalk of the pituitary. This is the pituitary hypophyseal cerebri. I am drawing this one. This is the pituitary. I am drawing the pituitary here. This is the pituitary which is lying medial to this one. So first of all, now I am coming. If we completed this within the cavernous sinus wall structure line, the third nerve, fourth nerve, fifth one, fifth two in the lateral wall. In the medial wall, the internal carotid artery surrounded by the sympathetic plexus, along with the abducent nerve. So let's discuss about the what structure lying outside this one. First and foremost, if I am talking about the medial relation, okay, the important thing is, you can see there is hypophysis cerebri. Hypophysis cerebri is lying here, and underneath this one there is a sphenoidal, clearly indicating the sphenoidal air sinuses. sphenoidal air sinus is about to downward. The structure which is about to downward, the structure lying in the medial wall of this cavernous sinus is the hypophysis cerebri, this one, and the sphenoidal air sign about to downward. Okay. Now coming reciprocally, the laterally, okay, laterally, and for lateral aspect I am drawing the brain area here, brain area, and plus you can see there is a structure. If I am talking about the lateral aspect, laterally there is the cavum trigeminal, What is cavum trigeminal? That is a cavity. Okay. If I am looking in this bone, here is the cavum trigeminal. This bit is cavum trigeminal, which is surrounded by the dura. Okay. This cavum trigeminal, which is lying lateral to this one and having the emerger of the trigeminal nerve. Here it is, the cavum trigeminal. Not only that, even this part, if I am looking in this area, the greater wing of sphenoid bone, which is having the temporal part of the bone. This area having the temporal part of the bone. Okay, this is having the temporal part of bone, especially the uncle part of the temporal bone. Uncle part of temporal lobe of brain is associated with this one. Okay, so we decided about the boundaries. The medially there was the hypophysis cerebri. Below this one there is the sphenoidal air sinuses. Laterally there was the temporal lobe and especially the uncle part and cavum trigeminal of this one. But what above and below? If I am talking about the above, there is a looping of this artery, the internal carotid artery, after the looping presenting in this area, and so this is the internal carotid artery, looping of the internal carotid artery is present there. Plus there is the optic tract. Optic tract is present. The optic chiasma is present there. Optic chiasma is present. I am rubbing this, I am removing this part. So optic chiasma is present there. Optic chiasma is present. So two structures. One is internal carotid artery as well as the optic chiasma. Internal carotid artery, which was running in the medial wall of the cavernous sinus, taking a turn above through the carotid-crinoid canal, reappearing at the roof of this one, appearing and continue in the brain, and this upturning and turning this known as carotid siphon. So this is the internal carotid artery, which is again going in the roof of the cavernous sinus with the optic chiasma, and an additional thing is anterior perforating substance. This is above. Below, a very clinically important structure, that is the foramen ovale and the foramen lacerum. If I can show you here in this bone, just below this one, this is the foramen lacerum, which is lying posterior inferiorly, and this is the foramen ovale. Very important. You should always remember the structure passing through the foramen ovale to understand the cavernous sinus too. We will discuss this clinical importance of the cavernous sinus and the foramen ovale later on when we discuss about the communication. Okay. So above optic chiasma, siphon with a siphon internal carotid artery, part of the internal carotid artery, and anterior perforating substance. These are above. Below there is the foramen lacerum and foramen ovale. Remember foramen ovale, okay, because the structure passing from the foramen ovale outside the brain is entering into the cavernous sinus. That is emissary vein. Okay, remember that point. Okay, below, then above, below, the medial, lateral. What about the anterior and posterior? Look at this diagram, which is showing a transverse section. Anteriorly there is a superior orbital fissure. And posteriorly, if I want to draw this one here, there's the petrous part of temporal bone. The petrous part of temporal bone, a triangular bone. This is the petrous part of temporal bone. Petrous part of the temporal bone. And book also says anterior to the petrous part of the temporal bone, the foramen lacerum is there. Okay. So these are structures. I'm revising this structure. Anteriorly there is the superior orbital fissure. Posteriorly there is the apex of petrous part of temporal bone. Above there is the anterior carotid artery, optic chiasma, optic tract, as well as the anterior perforating substance. The laterally there is the temporal lobe, the uncal part of the temporal lobe with the mandibular nerve or trigeminal cavum, trigeminal, durameter fold, and medially hypophysis cerebri with the spinal sinus. These are externally related structure to this cavernous sinus. Okay, so these are something about the relations, and you know, whenever it's going to thrombose, this is going to make them sufferer. That is third nerve, fourth nerve, and onwards. But important things are now coming toward the tributaries. What are the tributaries? What is this draining? Whom is draining? Okay, let's talk about the drainage system of this one. First and foremost, from this cavernous sinus, a vein which is passing and receiving blood from the eyeball, from the external space of eyeball, that is known as superior orbital vein. Superior orbital vein, superior ophthalmic vein. Superior ophthalmic vein. And I want to revise it that this vein is draining outer aspect of the orbit. Okay. Second is, this is receiving from the medial compartment of the, and this is known as medial or inferior ophthalmic vein. Ophthalmic vein. So one superior ophthalmic vein, two inferior ophthalmic vein, and one vein which is coming from the optic canal, and that vein is known as, third one, central vein of retina, and that is draining inside aspect or the curtain of the eyeball. Three important vein: the superior ophthalmic vein, the inferior ophthalmic vein, and the central vein of retina. Superior ophthalmic vein, inferior ophthalmic vein from the outer environment or the orbit of the eyeball, and central vein of retina from the curtain of the retina, that is the central retinal vein. Okay, that is important. So you can see here, if you are emphasizing much on the topic, you can see third, fourth, sixth, that belong to eyeball, and even the superior and inferior ophthalmic vein, that belong to eyeball. That means cavernous sinus having a major relation with the orbit and eyeball, and it will help us to understand about the clinical aspect of this one. But not only the eyeball, this is also draining a few veins. This is also draining, I am drawing here to reduce the confusion. This is also draining the superficial middle cerebral vein, as well as the inferior cerebral vein. So if I want to count the tributary, the superior ophthalmic vein number 1, inferior ophthalmic number 2, central vein of retina number 3, superficial middle cerebral vein number 4, inferior cerebral vein number 5, and so on. And one more, along with this one, look at this one in this diagram also. This is the orbital fissure. From this eyeball is drained, and this is a sinus along with this one. This is the sinus along with this one. This is known as sphenoparietal sinus. If I want to draw this one, this is running like this, and this is known as sphenoparietal sinus. Sphenoparietal sinus. So after the relation, let's start to discuss tributary. Count number 1, superior ophthalmic vein number 1, the inferior ophthalmic vein with me, inferior ophthalmic vein number 2, central vein of retina number 3, and all 3 from the eyeball, 1 inside the eyeball, 2 outside the eyeball, is sphenoparietal sinus, which is running along with the lateral sulcus, okay. Then middle, the superficial middle cerebral vein and inferior cerebral vein 2. These are tributaries, these are draining. But communication are other than this one. Communication are other than this one. We discuss about the external internal relation, we discuss about the external relation, we discuss about the tributary, and let's discuss about the communication of the cavernous sinus. When we talk about the communication of the cavernous sinus, I want to draw this diagram to show you a transverse sinus. A transverse sinus, a sigmoid sinus forming a bulb and then internal jugular vein here. The transverse sinus, the sigmoid sinus forming a bulb here and then internal jugular vein. Okay? If I want to do this one, again the transverse sinus, the sigmoid sinus and internal jugular vein. The transverse sinus, sigmoid sinus forming a bulb and starting internal jugular vein. Okay? With this one, from the medial aspect of this one, this is running with the upper border of the petrosal bone, superior border of the petrosal bone. This is communicating with the transverse sinus. Okay, in this diagram we are showing this one, and even in this bone, if from this cavernous sinus area a structure which is running like this one definitely communicate with this groove, that is known as transverse sinus. So cavernous sinus is communicating with the transverse sinus via the superior petrosal sinus. This is the superior petrosal sinus. Why the inferior petrosal sinus? This is opening outside the cranial cavity. This is opening outside the cranial cavity. In short, I am reading this one, inferior petrosal sinus, which is opening outside the cranial cavity, and this sinus is running along with the inferior border of the petrous part of temporal bone, and this is opening outside the cranial cavity. That is the specialty, that is the uniqueness. Inferior petrosal sinus is communicating through the internal jugular vein. Superior petrosal sinus, transverse sinus. Why the superior petrosal sinus is draining into the transverse sinus? Why the inferior petrosal sinus is communicating into the internal jugular vein? And I can resume both the diagram to the transverse sinus and why the inferior, this one, into the internal jugular vein. Not only that, this is communicating with each other. Anterior to the pituitary, this is indicating the hypophysis cerebri. This is communicating with each other by the help of the anterior intercavernous sinus and posterior internal cavernous sinus. So this is forming a circular arcade of the venous plexus here. Okay. Not only that, this is also communicating to a basilar plexus which is lying on the clivus. This is known as basilar venous plexus. This is basilar venous plexus. Basilar venous plexus. So this is communicating with the major transverse sinus. This is also communicating with the internal jugular vein. This is also communicating with the basilar venous plexus. Okay, 3. And very important, this is communicating with the outside. Okay, below this there was a foramen ovale, and foramen ovale having a emissary vein. This emissary vein communicating the pterygoid venous plexus with this cavernous sinus. Pterygoid venous plexus, which cannot be shown in this diagram. Pterygoid venous plexus with the help of the emissary vein. Okay, the communication through the superior petrosal sinus, communication through the inferior petrosal sinus, communication through the basilar venous plexus by the sulcus venosus, and by the emissary vein into the pterygoid venous plexus, and not only that, to the eyeball also. There are the two channels by which this is communicating with the facial vein. One is the this part of the nose, just below the nose and above the upper lip. This area drained into the facial vein. The facial vein drain into the deep facial vein. the deep facial vein draining into the pterygoid venous plexus, and pterygoid venous plexus communicating via the emissary vein through the foramen ovale. So I was focusing on that point, that inferior to this cavernous sinus there is a foramen ovale. So there is a proper channelization: facial vein, then deep facial vein, pterygoid venous plexus, emissary vein, and to the cavernous sinus. A pimple or foci of this region. This all channel is the valveless channel. A pimple or foci of that region may reach directly to the cavernous sinus and cause the symptom of the cavernous sinus thrombosis. So this area is known as danger area of phase 2. Not only that, with the help of ophthalmic vein, which is communicating with the facial vein, the thrombus can also come from the anterior aspect of this vein. So these are very, very important. And once the cavernous sinus gets thrombosed, it can thrombose to the other cavernous sinus. This is also communicating to the superior sagittal sinus too, with the help of middle cerebral vein. So it can thrombose to the superior sagittal sinus, it can thrombose to the transverse sinus, it can thrombose to the internal jugular vein area. Okay, so a very, very small 2 centimeter by 1 centimeter small cavernous sinus, not only on its insult, not only going to communicate with the other cavernous sinus, now it also can produce the symptoms. And let's discuss about the symptom, clinical symptom on the cavernous sinus. Okay. So if the cavernous sinus get thrombosed, the superior and inferior ophthalmic vein, which is in short superior ophthalmic vein and inferior ophthalmic vein, this will cause the edema of the orbit. So eyeball will protrude outside, and that symptom is known as exophthalmos. Okay, that will known as exophthalmos. Not only that, the third, fourth, and the sixth nerve, palsy can lead to the ophthalmoplasia. That is inability to move eyeball frequently, because these nerves are governing. So major impact which is occurring on due to the thrombosis of cavernous sinus is on the eyeball. Okay, one is superior ophthalmic vein, inferior ophthalmic vein thrombosis or not draining blood into this one, so that will lead to edema of eyeball, and that is known as ophthalmos. Second is due to the paralysis or partial paralysis of third, fourth, and sixth nerve, ophthalmoplasia. Not only that, whether due to raised intracranial tension due to this thrombosis or due to the central vein of retina is unable to take the venous blood from the eyeball, that will lead to the central vein of retina eyeball, that is known as papilledema. So the trio, one more thing, the superior ophthalmic nerve or the ophthalmic nerve of fifth one is passing through this one, and that is a sensory one, and thrombosis of the cavernous sinus will lead to the pain in the orbital area or in the division of the ophthalmic nerve. So now counting the symptom: pain in the orbital area due to the ophthalmic nerve, number 1. Third, fourth, sixth lead to the ophthalmoplasia, number 2. Superior ophthalmic vein, inferior ophthalmic vein lead to the periorbital edema, that will show eyeball as a protruding out, that is exophthalmos. And lastly, central vein of retina or due to raised ICT, there is the papilledema of eyeball. And these all are classical sign of the cavernous sinus thrombosis. Not only that, sometimes there is aneurysm is present in the internal carotid artery, that will be lead to the pulsatile exophthalmos. If that means the eyeball is protruding with the one pulse again going inside, that is pulsatile exophthalmos. If you are putting a stethoscope on the orbit, that will show you the bruit, you can hear the brutes. Okay, that is sign, that is due to the aneurysm of the internal carotid artery of this one. Again, in a concise way, I am concluding this topic, that is known cavernous sinus. The cavernous sinus is a 2 by 1 centimeter sinus which is which is divided by the septa, so it's known as cavernous sinus. This is important because few important structure in relation within the cavernous sinus, third, fourth, fifth one, fifth two nerves. Medially, there is internal carotid artery with the plexus and the abducent nerve. If I'm talking about outside, above there is optic chiasma and optic tract, internal carotid artery. Below there is a foramen ovale, which cannot be shown in this one with the this nerve. Okay. Medially, hypophysis cerebri and inferior sinuses. Laterally, the uncal part of the temporal lobe and the foramen ovale, which is taking the emissary vein, which is communicating with this one. Okay, and these are important structure within the relation of this cavernous sinus. When we talk about the external and internal relation, then we are coming to tributaries, and most of tributaries are coming from the eye orbit, and tributaries coming from the orbit are superior ophthalmic vein, the inferior ophthalmic vein, and central vein of retina. Whenever the cavernous sinus is thrombosed, that will lead to the exophthalmos as well as the papillary edema of the orbit. Then sphenoparietal sinuses, which is passing through the lateral sulcus, the superficial medial cerebral vein as well as the inferior cerebral vein too. These are the tributaries. Okay, and you can assume what will happen if tributaries are blocked. Not only the orbit is affected, even the partial edema of the cerebral hemisphere will be there. And important thing is, not only that, this is again alone is thrombosed, and it can be thrombosed from the outer source at danger area of the face and orbit. Even the infection of the orbit can lead to the thrombosis of this one. Okay, this may spread, the infection, it may spread to the major sinuses through the superior petrosal sinus. It can thrombose to the transverse sinus. While the inferior petrosal sinus, it can directly drain into the internal jugular vein and it can cause thrombosis there. With the basilar venous plexus is also communicating with other cavernous sinus with the help of anterior intercavernous channel and posterior intercavernous channels are there. And not only that, is also communicating with the superior sagittal sinus. A vast network, a very small sinus can affect multiple channels, and that may lead to the inability of venous return to the internal jugular vein, and that will cause the hazardous effect, that is the raised intracranial tension. You should read a triangle of raised intracranial tension from your book. That will help you how dangerous the sinus, which is communicating outside the brain too, infection of the orbit and danger of the area of the face can lead to the symptom in the brain. Okay, so this topic is important from the examination point of view as well as the clinical anatomy. I'm happy to restart with this important topic from examination point of view, and this is again asked in the similar points as define cavernous sinus in its location, its dimensions or definitions, internal external relations with the tributaries as a communication and clinical applied, and this may be a long question. Okay, and this is very important topic. So with the best wishes for your upcoming examination in a few months, I request you to kindly subscribe and like my channel. Thank you.